As we continue on our dementia care journey, we at McCormick Care Group are excited to be celebrating our 150th anniversary. It's a time for celebration, but also a time to reflect on how we got here. First, our origins. Our story began in 1874, when we were founded as the Women's Christian Association, and our members went from one home to another on board sidewalks to minister to those in need.
The Women's Christian Association was started by women and remains governed by women today. The WCA responded to needs they saw in our community here in London for unwed mothers and their children, orphans, and the elderly. Today, these organizations continue to serve our community through Marymount and Parkwood Hospital, as well as Wellspring.
Our original mission was to fill service gaps in the provision of care and distribute charity and care to the poor and the sick. We started in London with a soup kitchen in the Covent Garden Market and a women's refuge and children's home on Grey Street. Then, to serve the needs of a fast-growing elderly population, we created the Home for Aged Men and the Home for Aged Women in 1887 and 1888, respectively, combining the two as the Aged People's Home in 1892. This is now McCormick Home, one of our 4 divisions. Shortly after, in 1894, we founded the Home for Incurables, now Parkwood Hospital, for ministering to the needs of the sick. In 1926, the Aged People's Home was renamed as the McCormick Home after Thomas J. McCormick, a benefactor and a London food manufacturer who was known for running one of the largest, most modern confectionery and biscuit factories in North America. He was the one who generously donated his home to the Women's Christian Association for the care of the elderly, and whose legacy we continue to remember as a key founder of McCormick Home. In 1986, Alzheimer Outreach Services, later known as McCormick Dementia Services, was established at Parkwood Hospital, soon becoming the largest dementia day program in Ontario. 13 years later, we started Wellspring of London and region to serve families across the area who are battling cancer. Wellspring has since been successfully transitioned into a standalone organization and continues to serve those in need of cancer care and support. In 2006, both McCormick Home and Alzheimer Outreach Services were relocated to Keynes Road in London. It was shortly after this time that we developed a new strategic focus, serving those who are impacted by dementia and improving their quality of life. And 10 years later, in 2016, we rebranded as the McCormick Care Group and launched McCormick Dementia Research to collaborate with other research institutions and find new ways to enhance the model of dementia care. That brings us up to now. We have a lot to show for our 150-year commitment to provide care for the people of London, and we're in a great position to continue on this path. Today, as the McCormick Care Group, we operate McCormick Home, a long-term care facility for seniors, McCormick Dementia Services, to provide care and support to people living in the community with dementia and their care partners, and McCormick Dementia Research, to push innovation in dementia care and develop new ways to manage dementia for people and their families. And while each plays a unique role in caring for those living with dementia, they're all guided by the same principles.
I see compassion in the work that everybody does here every day. People listen and understand the residents and their needs, and they work to make their experience the best possible each and every day.
And when I think about respect, I think it's best reflected in a bit of a ceremony that we do here called Honored Guard. And when an individual passes away, the staff line up at the front door, and the individual leaves our building under the warmth of a quilt that was actually made by other residents.
We are highly engaged with researchers to ensure that we are providing best practices in all of our services, as well with our collaborations with networks and system partners.
I don't think there could be McCormick Care Group and specifically McCormick Dementia Services without collaboration. We're always consulting with each other to set our clients up for the best experience possible.
As an organization, we're proud to have served the London community with services for 150 years, and there are some that are still active in our community today. Our work with dementia care has become our main focus, and we're proud to serve as a partner with other care providers to support those impacted by dementia.
I find that this fusion between academia and improving health is not just a job, it is a passion in trying to make sure that there's improved quality of care of people living with dementia.
And we have to be, because Alzheimer's Society Canada estimates the number of Canadians living with dementia will rise 39% from 2020 to 2030, from just over 500,000 to just under 1 million. More alarming, though, is that 87% of care partners wish more people understood the realities of living with someone who has dementia. This is where quality care matters, and why advancing dementia care and understanding the real need is so important. Living an enhanced quality of life starts with having people around who care. We care about people living with dementia. We care about their comfort, their quality of life, and the quality of the home they live in. We care that their families and care partners have helpful resources and that they have support when they need it.
They're very good. There's no doubt about it. You know, where else are we going to get that kind of support other than here?
I liked it from day one. It's a very beautiful place and everybody's friendly.
We care about the community of health professionals working tirelessly to find new care models and adaptations. And we care that we share what we've learned, and in turn, what we've learned from others, as we work together to improve the model of dementia care. And moving forward with care is what we're set up to do well into the future.
So I've worked in the health system in London and area for many years, including some time with the Ministry of Health. So I have been aware of WCA, formerly known as the McCormick Home and McCormick Care Group, for decades, and have had the opportunity to work with them on a variety of different projects and in a variety of different ways, and have always been very impressed by their leadership, by their willingness to collaborate with others, by the knowledge that they are always able to share, and they always have been leaders in the space, both in long-term care and then when they began in the community support services stream as well.
One of our priorities as we enter our next phase is all about collaboration, because moving care forward is so much more powerful when it's done in numbers.
Historically, we've been focused more on the enrichment of individuals that are cared for by the McCormick Care Group, whether in the home or the day client or the dementia services, the day client side. But now we're starting to look at different innovations and research elements that will propel dementia care into the future.
The programs we're implementing are specifically designed to encourage involvement and mutual support. Some of these include efforts to better understand the needs of families, care partners, and care staff. Others focus on optimizing the design of living spaces for people with dementia, gaining a deeper understanding of how residents develop and maintain social relationships, improving quality of life with activities like therapeutic gardening and exercise, predicting the onset of behavioral responses, and managing responsive behaviors with animal-assisted therapy. The new partnerships we're forming with networks, organizations, and research and policymakers are strengthening our ability to transform systems of care for people with dementia and their families. We've partnered with Western University, Fanshawe College, Lawson Health Research Institute, and Baycrest Health Services, to name a few. And we're continually expanding our reach to work with many experts in the dementia care field.
In order for McCormick to be a leader in dementia care, it means that we have to collaborate with our research partners. We're very, very proud
the relationships that we have with Western University, Fanshawe College, just to name a couple. We can't provide the care that we do at such a high level and be innovative if we don't have those relationships. It's through working together with them and engaging with our community, asking questions of our care partners, of our clients, testing things, getting feedback. That is how we enhance the quality of the services that we provide.
My collaboration with McCormick goes back nearly a decade, and it's one of the most rewarding and joyful parts of my job. It's also the most impactful. Research on how to provide the best care for persons living with dementia and their family care partners is critical given population aging across the globe and of course here in Canada. And I really like to think about it in this way. In at least any one point in our lives, we will be called to care for others.
Our goal is to be recognized as one of Canada's leaders in innovative dementia care, and we plan to do it by delivering the highest quality of care we can provide. Because when everybody's moving care forward together, we can help those impacted by dementia live an enhanced quality of life. On this occasion of our 150th anniversary, we extend our sincerest thanks for your dedication and support. We look forward to continuing the work we do with our partners and supporters to enhance quality of life.
Well, I would like to say congratulations to our extraordinary organization on reaching the magnificent milestone of 150 years, and happy 150th anniversary, and yes to countless more chapters of success, growth, and making a difference.
You know, I want to congratulate the McCormick Care Group on an incredible milestone, 150 years of unwavering service, commitment to our community. Your dedication to supporting the care for individuals over the years and is a testament to the profound impact you've made. And here's to your legacy of compassion, of transforming lives and creating a brighter future for everybody that you serve. So congratulations for this remarkable milestone.
I just want to add my heartfelt thanks and congratulations to everyone who's contributed to the success of the McCormick Care Group over the past 150 years.
On behalf of my research lab, I extend my heartfelt congratulations to McCormick Care Group on reaching this incredible milestone of 150 years of service to persons in need. I appreciate how you integrate innovation into everyday care practices in order to make a meaningful and positive impact on persons living with dementia and their family care partners.
Yeah, my congratulations to the 150th anniversary on the good work that they do here.
I want to offer congratulations to McCormick Care Group for 150 years of service. What an incredible accomplishment.
It is amazing to be a part of an organization that has helped shape the London community for 150 years. Congratulations, McCormick Care Group.
There have been so many amazing women that have been part of this organization who governed it from the beginning and continue to govern it today, 150 years later. I am so proud to be part of that legacy. I have so much confidence that the organization will continue to serve well into the future. Congratulations on 150 years of compassionate care.
It's with deep gratitude that I'd like to thank McCormick Care Group for their incredible work over the last 150 years, and especially currently as my husband and I are going through this journey, and because of their help, we don't feel like we're doing it alone. Really, if you're in the London area, you really need to make that phone call to them, to your care coordinator first to get in touch with them, but their services are really amazing, and they change the journey direction, because doing it alone, you just really need somebody that leaves the porch light on for you.
Join us in moving care forward.
I think you all do an excellent job. Thank you very much.